So what kind of a little nubbing are we dealing with here? It's like a little bump on the face. You can tell anytime there's a little dome with a flat, it's almost always a bump on the nose, and they thought it was a basal cell, like every time, right? Yeah, it's something sebaceous. So then we got to decide where. There's not very many options in the sebaceous family. Unfortunately, sometimes sorting out which option can be challenging, even though there's not a lot of options. The main options are sebaceous hyperplasia, right? Which is basically big, huge, very mature looking sebaceous glands, very white appearance, okay? And then there's sebaceous adenoma and sebaceoma, which to me are on a spectrum and is just splitting of, not splitting of hairs, splitting of sebaceous glands, I guess. If you have more than 50% blue basaloid cells and less than 50% of the white mature bubbly cells, you can call it sebaceoma. If you have a predominance of the bubbly cells and fewer of the basaloid cells, you can say sebaceous adenoma. It doesn't matter, okay? And then there's sebaceous carcinoma, of course. This is a small lesion. It looks like they got most of it with the shave. I think arguably there's more than 50% bubbly cells here. And you can't really see the bubbles real well, but they are little vacuoles and they're clear because they're filled with lipid and they dent into the nucleus. It's the same kind of rule I use for sebacites as I use for lipoblasts, okay? In the soft tissue, an atypical cell that's in a mesenchymal tumor that has clear bubbles and indents the nucleus, those are lipid droplets and it's probably a lipoblast. In an epithelial tumor, bubbles that indent the nucleus usually are gonna be sebaceous. I do see squames that are vacuolated that seem to just be squame and not sebaceous that do actually have true bubbles though. So I've come to doubt myself over time with that. But anyway, this I think is a sebaceous adenoma. And we usually in our practice include a comment in the report that sebaceous adenomas are sometimes associated with Muratori syndrome, okay? What's Muratori syndrome? Yeah, it's a mismatch repair. It's basically hereditary non-polyposis colorectal cancer syndrome with the addition of sebaceous tumors of the skin, okay? So sebaceous adenoma, sebaceoma, and some sebaceous carcinomas, when they're off the head and neck usually, can be associated with that. Sebaceous hyperplasia has no association. We don't routinely perform the stains for the mismatch repair genes, but we will do it upon request. Different people have different ways they handle that. So we just usually put that comment in the report and let the treating physician decide how they want to address it depending on the patient's clinical situation. I find that you should not have marked atypia, you should not have atypical mitosis, and you should not have infiltrative growth. Those are worrisome signs for sebaceous carcinoma. The problem is that mitoses are often found. And I was giving a lecture one time and I couldn't find a single sebaceous adenoma in my entire collection, which is pretty extensive, that didn't have a mitosis. And that, to me, that either means I misdiagnosed a ton of sebaceous carcinomas, which I think is probably not the case because no one yet has come and say that, or it's just that mitoses are there. So don't get freaked out by a few mitoses in these. And the basaloid cells, they look blue and basaloid. That's normal, right? That's what normal sebaceous glands have. So it can be a little hard to tell like how much is atypia enough. And if I have one that's a little funny looking and it's shaved across the bottom and transected, sometimes I'll say, I think it's a sebaceous adenoma, but it's got some atypia. Please do an excision just so I can see the whole thing. Because I did have one once that I thought was sebaceous adenoma and it recurred and it was actually a carcinoma, but on a superficial shave didn't look atypical at all. So I don't routinely recommend these be re-excised, but if I have something concerning and it's broadly transected, again, it's one of those things that doesn't happen that often and I would rather just have them go and make sure that we're seeing the whole thing than miss something serious.